All right, this is called Stump, the neurosurgery resident. See if I can. We're going to see how he does here. You know, you're the neurosurgeon on call, and there's a guy, you know, he's a business guy. At his lunch, he goes and works out. And he's working out, and all of a sudden, you know, he gets this pain, like, kind of right through here, like mid to lower thoracic region. And it's really bad, you know, and the guy says something's not right. So he goes to your emergency department, and he comes in, and you know, you're called to see him eventually, but when he comes in he said, my legs feel numb, I got burning in my legs, and I've just got this god-awful pain that won't go away. And let me throw in another thing real quick. So the people that saw him in the emergency department initially, obviously it sounds like his back. And so they're thinking, you know, I'm going to get a CT scan of the lower back and the thoracic spine, and that looks fine. I mean, the CT scans are normal, but at the very bottom of his spine, in his lower back, he's got a disc that's collapsed, and his spine is slipped, like, you know, this far over one of the bones. So he's got slippage of his spine. So then they do an MRI of his back, and they find that he has severe narrowing of his spinal canal where the slippage is. So you're called because now they found, you know, severe narrowing of the spinal canal. His spine is slipping. He's got this pain and numbness down his legs. He's got pain here. You know, what would you do as a resident seeing this guy? You know, that's all you know about him. Just was working out, healthy guy otherwise. What would you do? Like, how would you proceed from there?
Start by talking to him, hear his side of things.
Right,
you can read all you want in the chart. I would ask him, what exactly were you doing in the gym?
Yeah, I was lifting weights.
Okay.
Yeah, I was doing strength training.
Strength training in the gym.
Didn't fall.
No falls.
No.
Is he, I would want to know, at baseline, taking any medicines?
He's a healthy guy.
Drugs.
He's a healthy guy. He works out, yeah.
Okay. I'll get my exam.
Okay.
So I would want a lower extremity exam specifically, but then also I would want to kind of tease out where exactly he's feeling his back pain. You said it kind of
it's not way down low. It's more like upper lumbar, lower thoracic area, like right through.
It kind of wraps around both sides.
Yeah, it's like.
And it sounds like they imaged his lower back on an MRI. Did they get a thoracic MRI?
They did not get a thoracic MRI.
I think I would want a thoracic MRI.
All right.
To me, so I'm honing in on the kind of bilateral wrapping symptom. It sounds like a thoracic radiculopathy in a way, which could affect both legs if you have a herniated disc.
Okay, so that's something that you want to order. Do you want to do anything else first, or?
Assuming I've kind of completed talking to him, getting my exam, already looked at all the other images that he has. You know, probably talk to him
He's got normal strength and sensation in his legs.
Sure.
He's got his bowel and bladder's fine. He hasn't lost his bladder or anything like that.
Okay.
All right.
Yeah. Yeah, I would want to see what his thoracic MRI shows.
Okay. So he did not get a thoracic MRI. So, but let me tell you what happened. So you got to feel the pulses in his feet because he didn't have any pulses in his feet, and his feet were cold.
Interesting.
And when you're asked to see something like that, the attendings, what they're wanting you to do is take him to emergency surgery because he's got severe narrowing and slippage of his spine, and they're almost sure that's what it is.
To me, I think that.
But what I would do is, you know, you check his pulses, and then you get a vascular study, which confirms there's minimal flow in his lower extremities, so minimal blood flow.
Interesting, yeah.
And then you get a vascular surgeon, and he has a dissecting aneurysm in his lower thoracic spine, mid to lower thoracic. He's taken emergently to surgery, vascular surgery, has that taken care of, all his symptoms go away.
Yeah. That's super interesting. That's a really interesting case.